Hi, I'm Ralph Stevens. My website's ralphstevens.com. My business is Ralph Stevens Seminars. I've been a continuing education provider in the massage therapy profession now for about 25 years. And I'd like to share with you a few things that I've learned over that time, some things that will help improve your practice. Now, I'm at the Oakworks studios today, and we're filming these videos, and we're going to be using their Proluxe table with their new adjustable breast comfort system, which we won't be using today, but it's a really fabulous feature they're just introducing. This table goes down to about 18 inches. It's a double braced X-brace table, so it's very, very strong and stable, and it's handicapped accessible going all the way down to 18 inches. So we're going to bring our model out. I'm going to show you a nice tip for the abdominal wall today. Now, this area is a very undertreated area in the body by most therapists. Many just gloss over it or don't touch it at all. And that's very unfortunate because so much energy, so much emotion is trapped in this area because people sit and crunch this area in so much all the time. So even in a relaxation massage, it's very valuable to the patient to do just a little bit of work in this area, if nothing else, to get the movement of this area and relax this tension that people carry from not only their sitting, but from stress. So I'm going to teach you a nice little just 2-3 minute relaxation routine to open up the anterior abdominal wall here. So we're going to bring my athletic model in. This is Brennan. And if you'd sit down on the table and roll on your back here, we're going to take the body curve bolster. Positioning people on the table is really a science, and you want to put people in a very comfortable position because it's going to allow them to relax much easier so you don't have to work so hard and they're more comfortable and more likely to come back to your practice. So this body curve bolster has a nice little indentation for the spinous processes here. We're going to slip this under his neck. There, isn't that better? Yeah. And this is a nice air bolster. So you can adjust either bladder in this so that you can change the pressure of one side or the other, the shape of this bolster. So I really like this air bolster. This is a nice idea. We'll put this under his knees. Are you comfortable there? Okay, so we're going to bring the table up to my working height, which of course is going to be different for everybody and can even change during your treatment. That's a nice thing about the uplift tables. Again, the abdominal wall, we're going to primarily focus on just a nice relaxing routine here for you to do. So I usually start on the neck with my patient and then come down, and before I begin the body, I start on the abdominal wall. Whoops, I've got that up far enough now. There we go. So I'm going to warm up the lotion in my hands because we don't want to shock them with cold lotion on their abdomen. If you keep your lotion in a warmer, that would already be done. And gently make contact with their abdomen. Hover over the abdomen just a little bit and then make contact and go immediately to a nice moderate to firm pressure and engage and make a nice circular effleurage on the abdomen. We want to go in a clockwise motion as we're looking down at their abdomen. That's the way the colon flows in this area as well as the energetic centers. So do 3 to 6 circles and then go to a wave motion back and forth effleurage across the abdomen. This is very relaxing to the patient. Just a moderate pressure is all you're working at here. And then I like to strip down through the rectus abdominis using my braced fingertips and glide down through this 3 times inferior. I could come superior, and if I was doing structural work, aligning the pelvis, working with their posture, I might go down one side and up the other side. But for relaxation, I'll usually just do 3 strokes down each side of the rectus abdominis. And now I'm going to do a nice release right in this area of the costal cartilage and the obliques, because this is where people are so compressed from sitting. So this is going to get rectus abdominis and then the oblique attachment. Brennan, I want you to take in a big deep breath. And as he inhales, I'm going to go down along the costal cartilage, reach under his back. Now exhale, and I'm going to lift up with a nice vibration stroke across those vertical fibers of the internal and external obliques. Again, inhale. I'll do this 3 times. And a 3rd time. If they're ticklish, don't do the vibration, just do a nice firm stroke up across the obliques. But the vibration's a nice relaxing factor here to add in. I'll go back to a few circular effleurages, and I'm done in the abdomen. That, just as you saw, takes just a matter of maybe a couple minutes and is a real nice way to open up the flow of the whole body and to relax this area that's so contracted on people. Again, my name's Ralph Stevens. My website's ralphstevens.com. I have a video called Medical Massage for the Abdominal Wall that has a raft of therapeutic things to do in the abdomen area, all structurally based medical massage techniques that can help with low back pain, even neck and shoulder pain can be coming from the abdomen. So check it out. I'd love to see you. I'd love to see you at one of my seminars. My schedule's on my website. I'd like to thank Oakworks and you for watching this video. Thank you so much. I'm Ralph Stevens. Have a great day. Help lots of people.